Hi, I'm Devansh Saxena, a PhD candidate in computer science at Marquette University, and today I will be presenting our paper, A Framework of High-Stakes Algorithmic Decision-Making for the Public Sector, developed through a case study of child welfare. This work is being conducted with our collaborators, Karla Badillo-Urquiola and Dr. Pamela Wisniewski at the University of Central Florida, and is led by my advisor, Dr. Shion Guha at the University of Toronto. Okay, let's get straight to it. Public sector domains such as criminal justice and child welfare have increasingly adopted algorithms as the promise to improve efficiencies, lower costs, and provide better outcomes to citizens. But they have been performing poorly and instead are achieving worse outcomes, exacerbating racial biases, and concealing structural inequalities. So why is that? First of all, outcomes in the public sector are inherently different because it is hard to define what constitutes a successful outcome or intervention, because a person's life can stabilize and destabilize several times. Second, administrative data that is being used to train these algorithms is poorly collected and defined. Therefore, there are inherent biases that lead to unfair decisions. But there are other concerns as well, because algorithm design is not accounting for how algorithms interact with human discretionary work or bureaucratic processes. And that's why we need a framework. To develop this framework, we reviewed disparate yet relevant work in public administration, HCI, and STS. HCI scholars discuss human discretion with respect to how can we incorporate humans' tacit and explicit knowledge into algorithm design. On the other hand, when public administration scholars talk about human discretion, they refer to the street-level bureaucrats' decision-making latitude when navigating complex bureaucratic processes. And finally, STS scholars discuss the politics of algorithms in complex bureaucratic domains. We leverage a socio-technical perspective and synthesize these bodies of work into a cohesive framework. This is the ADMAPS framework that captures the complex interdependencies between core elements of human discretion, bureaucratic processes, and algorithmic decision-making. Next, I will discuss each of these elements and the dimensions within these elements. Human discretion is defined as a bureaucrat's decision-making process model where they use their professional expertise, make important value judgments, and engage in heuristic decision-making. Bureaucratic processes refer to the critical governance characteristics such as the resources at the organization and constraints within which all decisions must be made. This also includes the day-to-day administration as well as training provided to the bureaucrats. And finally, the laws and policies that all bureaucrats are legally mandated to follow. Algorithmic decision-making constitutes the relevant data necessary to make a decision and the type of decision support. That is, whether the tool is employed in a predictive or a prescriptive capacity, and finally, the degree of uncertainty associated with the outcomes. To validate and revise this framework, I conducted an ethnography at a child welfare agency where I attended collaborative meetings where algorithms were being used, and these meetings revealed the messy interactions between human discretion, bureaucracy, and algorithms. I also interviewed 20 child welfare caseworkers to further understand their perspectives on algorithms. This is what the life of a child welfare case looks like. The orange side represents child welfare, and the blue side represents a court system where all critical decisions are made. The red boxes contain algorithms being used at different stages. The purpose of this diagram is to highlight that algorithms are embedded within complex bureaucratic processes which directly impact how caseworkers interact with them. When an allegation of abuse or neglect is made at the hotline, a risk assessment algorithm helps the frontline worker decide if the call should be screened in for an investigation. If the call is screened in and neglect or abuse is substantiated, the case is referred to the child welfare agency. Then through the life of a case, the CANS algorithm is used to assess mental health needs of a child, the foster care placement setting they should be placed in, as well as compensations for foster parents. The 7EI algorithm is used to develop trauma-responsive services. LPS algorithm is used to track federal benchmarks such as placement stability, as well as policy and systemic barriers. And finally, there's an algorithm used to assess the risk of being trafficked for a foster child. Please refer to the full paper for more details on the ethnography. So what did we learn? First, algorithmic decision-making should improve human discretionary work and not seek to supplant it. To offer utility to bureaucrats, algorithms must support their decision-making processes instead of providing a predicted outcome, and algorithms should be centered in their practice. Algorithms often did not account for the data that caseworkers considered pertinent, which led to a high degree of uncertainty and consequently unreliable predictions. And therefore, it is necessary to design algorithms to support caseworkers' decision-making process model instead of providing predicted outcomes. Moreover, algorithms should account for the relevant protocols and legislation at the bureaucratic step where they are employed. Next, algorithmic decision support systems should be aligned with bureaucratic processes. All decisions, human or algorithmic, must be made within the resource constraints at the organization. Moreover, using an algorithm requires that the organization invest resources in training and make space for its proper utilization. And finally, algorithms must account for legislation that mandate all decisions. Balancing these trade-offs will help improve the quality of human discretionary work by ensuring that workers are adequately trained and the tool is being utilized properly at the organization. This further ensures that algorithmic tools receive collective buy-in at both the caseworker and bureaucratic level. Here are some implications for algorithm design. First, multidimensional outputs instead of singular metrics offer more flexibility in interpretation. This is especially important when there is a high degree of uncertainty associated with outcomes. Therefore, design of algorithms should seek to identify important sources of uncertainty and make room for value judgments and heuristic decision making. Algorithms should also be designed for collaborative use. As we witnessed in the ethnography, collaborative use facilitated team brainstorming and offered higher utility to caseworkers. We also observed that joint expertise and oversight improved fairness and accountability of the decisions being made. All algorithms in the public sector are constrained by the availability of resources, and therefore algorithms should account for these resources because they must operate within these constraints. And finally, if trade-offs between the core elements of ADMAPS cannot be managed, then we must explore alternative approaches to first resolve these underlying issues instead of introducing an algorithm that will offer no utility and only frustrate bureaucrats. Thank you. I'm Devansh Saxena. Please feel free to reach out to me if you have any questions. My email and website are listed below.